Like Brigida, this is one of my favorite days of the year, and I think this right here is my favorite moment of today. Today we're here to talk about science and discovery and shared data, but science needs a face, and progress needs purpose. And a shining example of that purpose is standing right here next to me, and I am honored to introduce a special guest today, a young woman who I've gotten to know quite well. Paisley should be enjoying a normal teenager life, getting ready to go to high school, and she should be out practicing on the softball field. But instead, she's fighting Ewing sarcoma, which, as you know, is a very aggressive bone cancer that requires very aggressive treatment, including chemotherapy, surgery, and radiation. She faces rounds of chemotherapy and surgeries that frankly would exhaust the strongest adult. She stands before us with incredible bravery and resilience, and she brings that very same softball team spirit to this fight. She reminds us exactly why your work matters. Behind every data point is a child fighting for a future, and behind every clinical trial is a family waiting for hope. Your discoveries in the lab change lives in the clinic. You are rewriting the stories for children just like Paisley. She inspires us to work harder and move faster. Please join me in giving a very warm welcome to Paisley.
Hi everyone, my name is Paisley Ramarge, but for a long time, I would say Paisley Isabella Ramarge, date of birth 5/20/2012, more than anything else. I get to stand up here and tell my story, but a lot of kids like me don't get that chance, and that's why this is important. But before hospitals and wristbands, my life looked completely different. Growing up, I was active. Baseball, track, cross country, you name it, I did it. I was excelling in school, your typical 10-year-old child. It all started in the fall of 2022, which was my 5th grade year. And as my life was perfect, which I still think I took for granted, I was running on the track a mile or so every single day at recess instead of playing in the playground. And I felt a pain in my leg, and I thought nothing of it. But then more time progressed to the point where it was painful, and I'm not one to complain. I'm always the person who you would see as, oh, you're so tough. She can handle anything. So I bring this up to my parents. I said, listen, this pain's consistent. Do you mind if we get this checked out? They're like, of course. So we go back and forth to the pediatrician multiple times, and they excuse it as either growing pains or stretch before you run. Little Paisley knew it wasn't stretch before you run. I've been running since I was in 1st grade, and I listened to them, but time went on to the point where I couldn't run anymore, and I was up at night screaming in agonizing pain as my mom and dad were comforting me, trying to let this pain stop. So after going multiple times to the pediatrician, they were like, this is the time we need to get this figured out. We can't just let our child deal with this. This is awful. So we go back one last time, and we demand to see PT because we thought, okay, they'll get us an x-ray. And the next time we go, they get us a referral to PT. And as I met PT, they gave us an x-ray. And that's exactly what we wanted. So the next day after school, I went to go get an x-ray. And my parents were called that night to the pediatricians. And they thought they were getting, sorry, it's a fracture. Well, that night they were either told I had osteosarcoma or Ewing sarcoma. And they were like, what is that? Then they figured out it was the word with the C, cancer. This is a disease that is well known as instant death, which you know that's not true, but that's how it's advertised all over media and across the world. And they had no idea how to process this. They were distraught. They couldn't control. They couldn't take this away from me. They always said, I wish I could put it onto myself. But they didn't tell me that night. My brother and I were still waiting to eat dinner after hours had passed, and they said I needed further testing. So The next day, my parents called multiple hospitals, but felt a strong connection to Hopkins because the fellow Dr. Goldenberg gave my mom a lot of comfort. And so we went there. We got in. I met Dr. Pertilis, Dr. Levin, and Dr. Goldenberg, and was entered into a room I'd once know very well. They said, "This is how we need to kill the tumor, blah, 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 blah." That's how it sounded to a 10-year-old who was clueless and had no idea what this is, and I still didn't know I had cancer. So, immediately, despite being 10, my world split open. I immediately had a biopsy and a port placement in the same surgery because they knew it was cancer just from the x-ray. It was just what specific cancer it was. I later learned that my chemo was going to be so potent that I had to do the cryopreservation to hopefully have kids. It's still not a guarantee. To fight the initial disease, I was put on 14 cycles of the VD/IE regimen. You can't possibly explain how bad chemo is unless you've had it. Dr. Pertilis and Dr. Goldenberg were by my side the entire time, all while highlighting their expertise in the field, which comforted both my parents and I. One notable chemo that changed my view on advocacy is doxorubicin. The harsh reality is that my first-line chemo was made generations before I was even born and wasn't even intended for my specific cancer. And yet, despite having to test my heart every so often to see if it was fried, I relapsed, spoiler, twice. The physical nausea is constant, where the cognitive toll is just as heavy. My brain knew exactly what it wanted to say, but the medication physically blocked the words from coming out. If you look up on Google or search engine, what is the harshest chemo? It is doxorubicin. They were giving the first chemo I ever received was doxorubicin, and I was 10. After 6 cycles through my treatment, I followed with surgery. It wasn't just a surgery. It was an extraordinary surgery on how my mastermind surgeon, Dr. Levin, saved my leg. Within the span of 16 hours, he removed the bone-wrapped tumor, a huge portion of my femur bone, cut out a donor cadaver bone to form the new femur, removed my fibula to place inside the cadaver bone, and moved the blood supply. Recovery was a nightmare, navigating the pain with a whole new leg. Although, I guess I got a reward, a battle scar and Starbucks. Lots of it. Even with this burden, I had 8 more treatments to go. But those 8 treatments are long. That means hundreds of more times back and forth from Hopkins, passing out from pain, all while having to lay still in the back of the seat of the truck because my leg was still healing in a cast that went all the way up to my chest. But so I was like, yay, I'm all done with cancer. I'm going to leave the past behind me. Well, the first time I entered the middle school building, trying to go on with my life, I was laughed at. I was bald and I had a walker, and I was reminded that, hey, your identity's taken away from you, a piece of you is taken away from you, and it's very dehumanizing. So ultimately, I found a nice group of friends. I was regrowing my hair. Everything was perfect. I was trying to recover, getting on my leg. I was still going from walker, cane, all the things, PT. But in the middle of 6th grade, when my life was looking together in 2024, it came back. You aren't naive anymore. You know exactly how bad the treatment is, having to face trauma you wanted to leave in the past because society isn't ready for an 11-year-old who's bald and uses a walker. This time, I was treated with 12 cycles of VIT, following with 34 treatments of radiation. My body was exhausted, already fatigued from the first go-around. Being an adolescent, I had to balance this out with school worries, losing my hair after finally growing my hair again, and emotionally processing this. Classmates are living their everyday lives where I am absent from school, getting chemo pumped throughout my body, praying to not throw up for the 10th time that specific day. Well, I go through all the chemo, this time, all the radiation, endured so much, and yay, you get to ring the bell for the 2nd time. 2 times a charm, finally. Maybe it was just this escaped cell, I would say. I was finally able to use my leg, getting into golf, which, by the way, wasn't my first choice. I wish I could still be on that ball field. I was getting into my normal life. I thought, I'm going to, again, put the past behind me. And while all my life was coming back together, the unimaginable happened again. A second relapse. Hope was low, but I had to continue the fight. I was given 2 more doses of drugs, but the tumor didn't die, but grew instead. It now wasn't about fighting the cancer, but rather surviving the treatments themselves. 15 more treatments of radiation blasted to my pelvis and iliac chain. And ever since, I'm declared no evidence of disease as of August of 2025. But don't think I don't do anything now. I take cabozantinib daily. It's not easy. And that is becoming my reality. Like, my average day has just been taking chemo daily. Like, I had to adapt to that. I had to figure out how to navigate and be like any other kid, except I'm taking a chemo every single day. There's so many side effects I can't even describe. No matter how bad I felt, though, I still hold my education as a top priority. It is something I can control, unlike my disease, in a way I can make an impact despite the brain fog, despite the missing school, even double school to make up work after I go in person the days I can. As I reflect on my journey, there are a few core truths I want to leave with you. We often look at people going through this and say, stay positive. But I've learned that positivity does not equal strength. True strength is facing a reality that no one should have to face. No child who plays with dolls should have to worry about if they're going to die, especially if they haven't even figured out what they wanted to be when they grow up. No child should have to take harsh adult medications like my cabozantinib I take every day because pediatric alternatives don't exist. Every rare cancer deserves an equal fighting chance because one of us could be the future of oncology. 10 minutes of your time is not enough to paint the full picture of what this journey is truly like. Surgeries I've left out, trauma, setbacks, missing counts, transfusions, or not being able to grow because the chemo and radiation stunned my ovaries are all things that affect both myself and other kids facing this. Kids deserve a lifetime. Let's ensure we get one.
Incredible, of course, what you have gone through and what you're going through. I wanted to ask, what would you tell us what we can do better? I know we need to find better therapies, but are there other things that you would want us to work on, or even how we can help you and other patients better?
Yeah, thanks for your question. I would think that looking at like the patient more as a human being rather than just saying, oh, take this, we're gonna blast this tumor. It's all about the cancer, but like we need to acknowledge like the patients under these circumstances and how that affects us. And yeah, I feel like, especially as an adolescent, like after, like once you show like a strong emotion, you're not treated like you're 5. Like other kids on the floor who might be young, they scream, they cry, I have to hear it, and it's awful. But whenever I actually experience a strong emotion, just because I'm older, I'm seen, I can't express my emotions, and I'm seen as like crazy or not, like if I relapse. But I just want to be felt seen, and I'm sure a lot of other adolescents battling this would like feel the same about that.
Thank you again. You've experienced a lot over these last 3 or 4 years. You're able to talk amongst all these adults, but you have a lot of experience that you could probably give to other kids going through the same thing. Have you thought about how you could spread your knowledge to those people?
Oh, of course, no, because before all of this whole story, I had no idea, like, the realm of oncology and radiation, all these types of branches of the field. And I'm actually pretty sure I want to go into oncology whenever I get older. And I feel like it's just great to be able to think, like, if I became an oncologist, I'm able to share, hey, I went through through the same thing, and I feel you. Because nobody knows how bad like chemo is until you can't even describe it. It's like telling somebody who never seen a dog before to draw a dog. But yeah, I'm so blessed and grateful to even in a horrible scenario to be able to share my now expertise in oncology.
And then you can decide if you want to go to Dr. Portillo's or to mine. Keep up the good work, and I'm
Thanks.
sorry of all the things you've been through.
No, I appreciate it, but you just got to make the most of your situation. And I can't give up because I know I have a future ahead of me. And it's so important to not look in the past, but to look in the future because there's greater things ahead.
Yeah, and I'll say to you what my kids say to me all the time, which is, I wish you knew nothing about that, Mom. So I wish that for you.
Thank you.
Well done, my dear. Congratulations. I'm so proud of you. Thank you so much. I'll see you.